Hello, everyone. In this video, I'm going to analyze an article that featured in the Hindu. Now, students, this article is based on the Asha workers, the fact that Asha workers have been recognized by the WHO. And in this video, I'm going to highlight the main points made in the article. Also, students, I'm going to throw light on the role and responsibilities of the Asha workers, who they are, what do they do. And of course, we are also going to talk about the various problems that are being faced by our health system. Okay, students, so let's get started. Now, students, the article is titled Serving Those Who Serve on WHO Honor for the Asha Workers. So, students, the World Health Organization has recognized India's Asha. Now, what does the acronym Asha stand for? Students, it stands for Accredited Social Health Activists. So basically, if you understand this, the Asha workers, we have this whole brigade of volunteer health activists. So, the government selects some, or basically, the females who volunteer to become health activists, they are trained and they act as an interface between the community and the public health system. So students, like I said, Asha health workers, they are basically a brigade of volunteer health activists, right? Now, students, the article says that recognition and credit seldom trickles down to the worker at the bottom. So yeah, so that's a fact, right? That not very often people at the bottom of the pyramid are like recognized for their efforts. So here they say that this is a step in the right direction and it is an attempt to right that wrong. So for years, people at the bottom of the pyramid, they are not being recognized, but now as an attempt in the right to set things right, or for that matter, step in the right direction, Asha workers have been recognized, and not just Asha workers, but polio workers of Afghanistan at the opening session of the World Health Assembly, students, right? Now, students, the award recognizes those who made an outstanding contribution to protecting and promoting health around the world at a time when the world is facing an unprecedented convergence of inequity, conflict, food insecurity, climate crisis, and a pandemic, right? So even though they've always, they've been working relentlessly at the lower level, basically, particularly at the lower level, but their role assumed critical importance at a time of the pandemic, at the time when there are parts of the world that are in a conflict, there's a war going on. Then students, food insecurity, there's humanitarian crisis in various parts of the world, there's a climate crisis, there's inequity. So students, as the world is facing all these unprecedented challenges, students, these workers, community workers, have played an outstanding contribution in protecting and promoting health around the world. The Asha were honored for their crucial role in linking the community with the health system to ensure those living in rural poverty can access primary healthcare services, right? So healthcare, students, is a challenge for, most people. However, it is a particular challenge to people living in rural and urban poverty, students, where even primary healthcare services, are like difficult to access, something as basic as primary healthcare services. So primary healthcare services is basically the first point of contact. Like when you see those initial symptoms of a problem, the healthcare units that you go to or you reach out to. So that first point of access, those small clinics and hospitals that you find at the lowest levels, they are known as the primary healthcare system. Then you have the secondary, and then you have the tertiary healthcare system, students. So basically tertiary levels that together make the healthcare system in India. So tertiary secondary and tertiary, would qualify for, they provide specialized services where advanced medical treatment is required. But primary healthcare services are like the basic healthcare services, students, right? And it was during the pandemic that the significance of these healthcare services was realized. So Asha, they were honored for their crucial role in linking the community with the health system to ensure those living in rural poverty can access primary healthcare services. Next, students, these workers, all women, faced harassment and violence for their work during the pandemic. Another important thing that I did mention, but I think I forgot to sort of underline that Asha workers are only females, only female volunteers. And that's because students, it's because they primarily look into the, maternity healthcare services, or for that matter, nutrition. So basically they have to deal with the women. And therefore, women are consciously chosen for these services. So these are women volunteers who are trained to become health activists. So students, the article says that these workers have faced harassment and violence for their work during the pandemic. And very true, students, because they were the first point of contact people used to reach out to. And in case of any problem being faced by them, they used to, basically that led to these people facing violence because of that. People used to attack them. They used to vent out their frustration and anger on this brigade. So it is this brigade that sort of faced harassment because of that. Now, while the pandemic made their job dangerous, it must be stressed that in general, their job takes them into difficult to reach places and hostile community students. So they have a very difficult job. Basically, they have to work in very remote areas, difficult to reach places, hostile communities where people do not welcome them. Right, we know that how things are in the villages. Students, they're driven by orthodox ideas. So usually health workers are not welcome. So they work in these difficult, conditions, and that makes their role even more important. Even as they contribute to better health outcomes, their workforce continues. This workforce continues to protest across the country for better remuneration, health benefits, and permanent post students. So now students, these people, they're working at the grassroots level, they're contributing, they are working in the most difficult situation. Yet students, they suffer from poor remuneration, that means poor compensation, right? And poor health benefits, and they don't get permanent posts, there's frequent transfers. So basically students, their work conditions need to be worked upon and improved. So this is one area where the government needs to, work upon, because there is increased demand for better working conditions and better compensation, right? So we're going to talk about that. What are the challenges that the Asha workers face? We're going to talk about that in a while. And students, then the article says that clearly certain kind of basic public health work are fraught with perils in several continents across the world. It is the duty of the government agencies that employ them to ensure their welfare, safety, and security. So basically the article says that now that the work of the Asha workers has been recognized by the WHO itself, the government needs to wake up to their dismal, poor working conditions. And it is the duty of the responsibility that this workforce, which carries out such crucial work of the government, to ensure their welfare, safety, and security. Okay, now students, let's understand who Asha workers are. Now, given that they were accredited, they were recognized by the WHO itself, there could be questions on this. So Asha student stands for, like I said, accredited social health activists. That's one. They're known as global health leaders, and they have been recognized by WHO. And there are about 10.4 lakh Asha workers brigade students. So basically 10.4 volunteer women health activists constitute this health brigade. Asha workers are volunteers from within the community who are trained to provide information and aid people in accessing benefit for various healthcare schemes of the government. Now, students, this is the primary job of Asha workers. So we all know that every year, like every budget, the government announces so many various health schemes, which look so good on paper, but we often see that somehow they fail to have an effect on the ground. And that's primarily because we need people who can better execute and implement. And we need that last mile worker. I'm not talking about a brigade of civil servants. Of course, that is crucial. But we also need those people who can work at the grassroots level, who provide that last mile connectivity with the beneficiaries. So basically, the primary role of Asha workers is to, provide information and aid people in accessing benefits of various healthcare schemes. That if a government announces a healthcare schemes, these people provide the beneficiaries or the people, right, especially at the village level, at the rural level, they provide them about the information, because very often it has been realized that the government runs these grand schemes, but the beneficiaries, the people who can actually benefit from those schemes, they're not aware of it. And that's basically because of illiteracy, very rampant and high illiteracy in the country, right? So these people have been trained, or they are trained to provide people with the information and help them access the health services. They act as a bridge connecting marginalized communities with facilities such as primary health centers, sub-centers, and district hospital students, right? So they connect the marginalized communities, the poor people, right, who are downtrodden, with facilities such as primary healthcare centers, sub-centers, and district hospital students. The role of these community health volunteer under the National Health Rural Mission was first established in 2005. So this role was basically, carved out for them, or this was the role that was identified for them. So students' eligibility. So it could be any female who is married or widowed or divorced between the age of 25 and 40 years from within the community. So from within the community means these people, they are selected from within the community that they work in, right? They don't get outsiders. It is people, because obviously there's a reason behind this, that when you select people from the community, they have a better connect with the people, right? They must have good communication and leadership skills. They should be literate with formal education up to class 8. So they should be at least educated till class 8. And the aim is to have one Asha for every 1,000 persons on per habitation in hilly, tribal, or other sparsely populated area students. So basically they need at least one Asha for every 1,000 person, which according to me is still, they need to increase this number to at least 5 or 10, Asha community workers for every 1,000 person. Salary, this also means that they are overloaded with work. Yes. Coming to salary, students, since Asha workers are considered volunteers, governments are not obligated to pay them salary, and most states don't. Now, students, this is the sad part, that they are volunteers, right? So the government is not obligated to pay them salary. They self-volunteer themselves to act as activists, right? However, they are paid a small amount just to support them. And this depends on the incentives under various schemes. So this small amount is also linked to their performance, basically. So this is not a fixed amount. This may vary from month to month depending on their performance. So currently it's to the tune of 6,000 rupees, 8,000 a month. Yes. Okay, students. So every Asha is supposed to be a fountainhead of community involvement in public healthcare program, primary point of contact for any health, right, particularly for women and children, and also operate as a community health activist. Students, basically the main job is to raise awareness, to increase awareness about nutrition, about hygiene, about the primary healthcare centers, about what health services are available, how can they be accessed, about various government schemes, right? And it is to mobilize the community to support local health strategy and enhanced adoption. Students, many a times our various schemes, they fail because people do not adopt them. So if there is a scheme by the government, the Swachh Bharat mission, that people should use like toilets or the urinals. So even though we have toilets and urinals in place, but people they've not taken to it, they've not adopted that practice, right? So it is here that the role of Asha workers has become very important, in nudging people to adopt positive behaviors, right? In fact, Asha workers played very important role with respect to the Swachh Bharat mission as well. Now, what are the specific duties, students? So very quickly, the duties, and then we move on to our Indian public health system. So go door to door in their designated areas, create awareness about basic nutrition, hygiene practices, and the health services. Focus primarily on assisting women during and post-pregnancy and educating them about nutrition of children. Here their role becomes very important, students, because women can openly talk to the women worker students while they hesitate talking to a doctor or a nurse, they can, talk openly to these community leaders, community activists. So their role becomes very important with respect to pregnancy and with respect to, nutrition, education about nutrition. Motivate children to get immunized, provide medicines daily to TB patients, and provide basic medicines and therapies for people suffering from various other issues such as anemia and malaria and contraceptive pills, right? So students, these are the main duties of ASHA workers. So what can we say after having studied all this? That ASHA workers, they are the health activists. They form this health activist brigade of the country. They are volunteers, and they play a very critical role in ensuring that the various health schemes and strategies of the government are a success. They act as a they provide that last mile connectivity or an interface between the community and the public health system, students, right? So now students, moving on. Now this, yeah, so there is crisis in the health sector. And how do we know that there's a crisis in the health sector? We did realize that, during the pandemic, our health system, the public health system, students, that collapsed in the face of the challenges that the pandemic posed. Now, with respect to ASHA workers being recognized students, so there's a lot of conversation around this in the media. So that, raised another question. They raised another question that these worker students, they suffer from a number of challenges with respect to their work. And then this problem takes us to the larger problem of the health system. So let's quickly read that. What are the problems being faced by the ASHA worker students? So it says that they get performance-based payments, not fixed salary, very poor remuneration, right? The payout is low, often delayed. They do not get benefits like pension or health insurance. There have been agitations demanding employee status because they are like volunteers. They don't have employee status, right? They do not get any benefits hence, and the salary is also not fixed, and the payout, whatever little they get, that's also very low and delayed. And there's strong argument to grant permanence to some of these positions with a reasonable compensation as for sustaining the motivation. So basically, students, there are increased calls to, change their work status, employment status from volunteers to that of permanent employees, to provide them benefits, to provide them the various perks and facilities that regular employees get. And if not that, at least improve their compensation and make that and regularize that, right? Now, students, this is the problem that our, the health brigade that works at the grassroots level faces, right? But the problems do not stop here, students. We did realize during the pandemic that our health system suffered from several challenges for that matter, that was termed as a crisis in our public health system, students. So let's quickly, this takes us to that larger problem of the problems being faced by our public health sector. So let's understand the students, ailing public health sector. What are the problems? Number one, our public health sector. Now, health sector, students, is made of both public and private, but a major problem that ails our health sector, students, is the ailing public health sector, that the government hospital, the government infrastructure, the government setup, health setup, basically, that is not allocated sufficient budget. Basically, the budget allocation is very less. That leads to overcrowding, students, because you have very little infrastructure, health infrastructure, to be utilized by a lot of people, and that leads to overcrowding. That is one. Secondly, students, lack of primary healthcare services. Now, what is primary healthcare services? I spoke about it a while ago, that it is basically the first point of contact centers for any health issues, like the clinics and the basic centers where you have physicians and general consultants, health consultants, who you could go to. So the first point of contact, students, the primary healthcare services at the grassroots level. This is, students, not up to the mark, and this is also very limited in scope. So basically the kind of services that are offered for them, it has been observed that they are limited to pregnancy and some other very basic services, but a lot of other services, health services that are required, they are absent, students. Paucity of resources, students, that's another issue. Enough investment is not made. Doctor work in extreme conditions. There are overcrowded outpatient departments, inadequate staff, inadequate medicines. The infrastructure is poor. And that's because, students, our total public spending on health as a percentage of GDP is very less, students. It is very less. The allocation that we make to the budget allocation that we make to the health sector, that is very low. That's very meager, right? So that's one area that needs to be improved upon. The government needs to increase the investment in the health sector. Next, students, expensive private medical education. So now, like I said, there's a paucity of doctors, there's a shortage of doctors, there's a shortage of the health staff, basically healthcare staff. And that's because, students, the private medical education in India is very expensive. And that's the reason we have, Indians going to countries like China, Russia, Ukraine, Philippines, and Nepal to, study medical. So basically, these countries have become popular destinations for aspiring doctors, as cost can be less than half of what private institutes charge in India, students. So basically, what the government needs to do here is the government needs to set up more government medical colleges, students. And of course, it should rope in the private sector also too, and we can have more private medical colleges as well, so that the cost comes down, students, and we can have more people opting for medical, and we have more doctors and healthcare staff in the country. Next, students, expensive medical studies are responsible for dearth of doctors in India, as after acquiring studies from abroad, they do not prefer to practice their profession in India. This is such an unfortunate, sad reality of our country, that people who go out to study, obviously, they lose that connect with the country. And of course, once they're out, they have spent a lot of time in a foreign land. They look for work opportunities in those countries, students. So very few doctors who are trained in foreign countries, they prefer to come back to India and work. And even the doctors who get trained in India, for that matter, they're leaving the country for more greener destinations, for better job prospects worldwide. Then, students, very expensive treatment. So more than 17% of Indian population spends at least 10% of household budget for health services, students. That's huge. In a country as poor as India, if you have people spend 10% of their household budgets for health services, I think that does not, show very positively or make the country look good, because 17% of Indian population, and you know what 17% of this would be? This would be the population at the bottom of the society. The poorest of the poor, they are forced to spend a lot of money on health services. Then, students, catastrophic healthcare related expenditure, right? Now, Competition Commission of India report on affordability stated that 50 to 65% of Indians did not have regular access to essential medicines. So it's precisely because of inaffordability. People cannot afford to buy even basic essential medicine, students, and not just a few, but 50 to 65%. And this is coming from the government itself. This is coming from Competition Commission of India, students. Then, students, doctor-patient relation, right? So students, there have been instances where the doctors have made a lot of errors, and there are instances of corruption among doctors. There are reports of corruption among doctors. Now, this has eroded the trust among the, between the doctors, the medical brigade, and the people, students. Somehow there's a trust deficit. Even when you're approaching a doctor, you're consulting a doctor, you're not sure of the kind of treatment, whether you're getting quality treatment or not. So people have lost that faith in the health system of the country, students. So there is this trust deficit that, in fact, students, has become a major concern, because there is rising violence against doctors. So obviously that means that there is the quality of medical services being provided in the country is poor, but that also means that there is, people are angered with the medical brigade, and therefore doctors have to regularly, face violence. And what would that lead to? Imagine if doctors are to regularly face violence, would that encourage people to take up medical education to become doctors in life? No. So that's going to students, trigger a vicious cycle, that doctors, because you have very few people pursuing medical, so doctors are overburdened. If they're overburdened, they're not able to provide quality services. If they're not able to provide quality services, that further angers the public, that leads to further trust erosion, that further leads to lesser people opting for this profession, right? And of course, overburdened doctors owing to disproportionate doctor-patient ratio. Limited number of doctors and nurses and medical staff have to cater to large number of patients, right? So basically, students, our healthcare system suffers from a number of challenges, and our Asha workers, who have now been even recognized by the WHO for their contribution, even they suffer from a number of problems and issues. So it's high time that the government does something about it. It should work on improving our healthcare system, as well as on improving the work and employment conditions of the Asha workers. So that's all for this video, students. I'll see you very soon with another video on editorial analysis. Thank you so much.